The following was recorded at the CCHF Conference 2023 in Cincinnati.
Welcome. Today's presentation is being brought to you by Jericho Road Community Health Center. We'll be discussing the vital role of operations management in refugee multicultural healthcare. As introduced, I'm Lorene Walker-Ibeka, and this is Stephanie Rivera, and we're presenting to you this morning. God's plan, alignment, position for greatness. For we are his workmanship created in Christ Jesus unto good works, which God has before ordained that we should walk in them. Ephesians 2:10, King James Version.
Good morning. So for all of those of you that don't know about Jericho Road, we just want to share a little bit of what Jericho Road is. Jericho Road started as a family practice by Dr. Myron Glegg and his wife, Joyce, with the goal of providing health care to all that walk through their doors, regardless of their ability to pay. But soon afterwards, they recognized the needs of the multicultural communities in Buffalo and other refugees arriving. And through the years, we've been blessed in providing haircuts to all of them. In 2003, Jericho Road Ministry was founded, and it sought to demonstrate God's compassion by fighting the poverty and addressing all the community needs. We've been blessed with great opportunities of growth. Today, we are staffed with more than 400 employees, and we offer different programs to support the community. And lastly, but not less important, we also offer the most needed health care to the population of Nepal, Sierra Leone, and Congo through our global work. Our mission and motivation of Jericho Road. Our mission is to provide a culturally sensitive medical home, especially for refugees and low-income community members, facilitating wellness and self-sufficiency by addressing health, education, economic, and spiritual barriers in order to demonstrate Jesus' love for the whole person. Micah 6:8. And what does the Lord require of you? To act justly and to love mercy and to walk humbly with your God. So some of the programs that Jericho Road offers, and we're just gonna let you know of the names, and later on you can just find some more information in our webpage. As we have an ESL initiative, Hope Refugee Drop-In Center, and financial education. We also offer Priscilla Project, Parent-Child, and the House Vive, where all the refugees and asylum seekers reside.
So this is a tradition that we do at Jericho Road. We share our story as to how we wound up or came to work for Jericho Road Community Health Center. So the journey to Jericho Road, and we'll start off with Stephanie's story.
So again, my name is Stephanie. I'm born and raised in Puerto Rico. I've been with Jericho Road for almost 2 years now, unfortunately following a separation and a divorce. I think it's more of a story of faith, as my plan wasn't being in Jericho Road. My sister helped me out because I was in need of finding a job to provide for my family. And soon after I started, I recognized that it was God's hands that were put on my life, and he was the one that brought me here. Because I found not only a family, but a place that I worked and share the same values and the same beliefs that I do. I started working in the front desk and grew my way up to work with the prior authorization team, and today I'm the service support team lead, and we have over 16 members in the team, and we overview the patient navigators, the prior authorization team, and just working on coordinating the new patient appointments. I have 2 daughters, which I'm very proud of them. They're just outside the room. And I'm very happy to be working for Jericho Road, and God has been the one that's been providing and is the one that put me here to be here and talk to you guys this day. Now, Lorene, you want to share your story?
So, a little over 2 years ago, I came to Jericho Road. I worked in corporate healthcare for almost 17 years, and around the pandemic, I started to lose my zeal for healthcare. I was losing that passion that I initially had when I first started and graduated from school. During that time, I was also in school. I was working on my MBA, and I had an experience in healthcare that changed my direction. I started off in the MBA program as a finance and accountant concentration, and I was also pregnant. I wound up delivering emergency C-section at week 26 in 3 days. My son was born 1 pound, 3 ounces, and we spent 255 days in the NICU. We went home for 2 days, and we went back to the hospital to stay an additional 22 days in the PICU. When we were first discharged, the discharge planner kept telling me I had first-time mom jitters. And I kept explaining to the medical staff and the team, no, I think something is wrong. My son is not breathing correctly. He stabilized, we was able to get home. And 2 days later, we came back and my son had a lung infection and he had to be re-intubated. So from that moment, I changed my major mid-program to healthcare administration so that I could be able to advocate for patients and make sure that they receive quality care and get healthcare administrators to listen to their patients even when they're advocating for themselves. Just don't follow the length of stay at a facility, you follow the person. I'm married, my son is now 3 years old, he's turning 4 April 3rd, and he's in school, so we're really excited for him. But God brought me to Jericho Road is on my faith. Like I said, I was working in healthcare for 17 years, and I took a leap of faith because I knew that God had something greater for me to do, giving me the ability to speak and pour into people. And I enjoy doing that every day with my teams. I'm the Assistant Director of Operations for Jericho Road. I lead a lot of team members, her team, service support, our prior authorization, our front office. I love the front office. Those are the people that meet and greet all the patients and help set the impression for the rest of the visit. So I really spend a lot of time in there trying to see what we can do to do better and improve. And God has given me a different view on healthcare from that standpoint. So now that I'm able to be in a position to where I can help hire, cultivate, and empower employees to help them make a difference as well, I enjoy that part of the job too. So the reason why we share our stories and tell people our experience is because it's always a source of inspiration to other people. Your story represents what you've overcome. Your story also represents a symbol of your faith, your ability to shift and transform, your ability to show your brokenness and how God has helped fix and repair you, but also that God has given you a purpose in your healing, and He's placed you right where you need to be. So if there are days and times and you feel like you aren't where you're supposed to be or you aren't where you want to be in your career, just remember that God has you exactly where you need to be. And you're in that stage waiting, and you will, explode and do some powerful things in the position that you're in.
Is there? So all this comes to being called to serve in healthcare. And what brings us to today's topic and that what we want to discuss with you. Operational efficiency and quality service is something that it does not happen overnight. We need to be mindful and have faith, focus, and compassion and commitment because these are keys to excellence. Now, excellence in operations management leads healthcare organizations to reach and sustain competitive advantage within the healthcare system. The medical teams were primed to productively respond to all sudden changes in administration without compromising our mission, our values, and our vision. So in this session, we'll discuss how operation management works and how it can increase operational efficiency, improve service delivery, and increase the care quality in the patient experience.
So healthcare commitment to service quality. Healthcare facilities strive to provide the highest quality of care to all of its patients. Healthcare facilities can do this by putting systems in place to monitor their performance, continually evaluating and making improvements on the services that they provide. So we're going to be talking a lot about process improvements, processes, planning, goal setting in this presentation. The multicultural experience with the U.S. healthcare system, it can be a very tough place to navigate, especially at the fact that you come from a country or a nation where health is not prioritized or you don't have access to it. Coming to the U.S., it could be very inundated on how much you really need to get done. Like your first healthcare experience, like if you are a refugee, you come in and you do a health assessment, and that might be like your first real thorough examination from a provider. From the lens of our patients, I always try to remember that that experience can be very hectic. It can be very scary because you don't know what to expect. When you come into the appointment, you don't know if they're going to be poking, prodding you, giving you shots, and then looking at every crevice that you have. So you just try to be very mindful and looking at it from the patient's perspective. And we always want to make sure that we look through healthcare through their eyes, because they are the ones who's going to be impacted by the services that you deliver to them at your clinics. So healthcare operations, the multicultural healthcare and refugee experience, as I just explained. The multicultural healthcare is having the ability to encompass compassion, to look at things from a different perspective, but also being culturally sensitive to the people that you're providing services for. You want to be very mindful that their experience is going to be completely different from yours. And you also want to make sure that you're holding judgment on the decisions that they make as a patient, even though it might not be the same judgments you'll make for yourself, but that patient is being empowered by using their voice at that time of the service delivery. The U.S. healthcare system, as I said, can be a very confusing place to navigate, so we want to make sure we're taking the time to educate our patients on the services that they have, guide them through the process. So if you have patients who are non-English speaking, who don't read and write in English, the goal would be to provide that information in their native language or their native tongue, or you provide interpreters that can translate the things that you want to communicate. So you will take the time out to personalize the care. This ensures that multicultural healthcare is accessible by striving to provide culturally competent care using language and cultural interpreters, which create an environment that is welcoming and accepting to all patients regardless of their background. You have to facilitate the connection between the providers, having them understand what the needs are, and offer guidance on how to access these services and use them. So another point to that would be like if you offer telemedicine, give that to the patient, because sometimes they may have like multiple kids and can't travel to the clinics with all their kids. So make access to healthcare easier for those patients who may have challenges. The other part is trying to make sure you leverage the technology that you have. So if you have access to an EMR system, kind of like educate your patients early on how to navigate their way through that system. If they need a phone call or a reminder, pick up the phone and call them and provide that added extra step of care. It is of the utmost importance that refugee, asylum seekers, and all patients are provided with information and are educated on their rights with the U.S. healthcare system.
So there are several keys focus to service excellence in healthcare. Service excellence in healthcare is a very important component of providing quality care to patients and to ensure that the patients receive the best care possible. There are several keys that we can focus on. The first one is communication. Effective communication is essential when it comes to healthcare. This means that we're making sure that patients understand what their conditions are, their treatment options, and the instructions that they are receiving. It also involves active listening to their concerns and providing the support that they need. Another part of this is respect. Respect for patients, their families, and the staff should be a top priority. This means that we're treating everyone equally with dignity and respect. Other key component, it's compassion. Compassion is an important attribute for any healthcare provider. Showing empathy and understanding any patient situation can help create more positive experience for them. Quality is also essential in healthcare. This means that we're providing the best possible services and the treatments are available for everyone out there. It also involves constantly evaluating and improving the processes that we have in place. Education for the multicultural and refugee members, community, it's absolutely important. Educating patients and the staff is critical for ensuring the best possible care. This includes that we are providing information about their medical conditions and treatments, as well as offering the training and the development opportunity to the staff that we're hiring for this.
So you all may be wondering, what does that have to do with the core functions of operations management? That has everything to do with the functions of operations management. Each of the things that we just discussed is encompassing in how your clinic operates and how those operations impact your patients. So operational planning, finance, product service design, quality control, forecasting, strategy, and supply chain management are all the functions that are needed to make sure that your healthcare systems run efficiently and effectively. So operational planning. Operational planning is you taking the time out to really sit down and strategize what you want to get accomplished in your clinic or with your teams or in any situation you do on your job. The first thing you want to do is maybe setting objectives and goals. And with those things, they help you stay focused and on track of anything you want to set accomplished. So if it is your goal to make sure that your patients come in on time for their patient and you want to reduce your patient no-show rate, things that you can do proactively is to send out text message reminders, send out emails, and then the old-fashioned way of picking up the telephone and actually calling your patient the day before or the day of if you have capacity at your clinic to help increase, to help decrease the no-show rate. Resources. You want to make sure that you have all the resources available to help support those objectives. You want to make sure that you have enough front office team members available to check in and register your patients. You want to make sure that you have a robust IT department that has the technology for your EMR system to use for patients to come online to check their appointments or set their own schedules. You also want to make sure that you have enough staff answering the telephones for when your patients call to be readily available to help service their needs. You also want to make sure that you're following the regulatory and legal framework in which your healthcare systems operate. So if you're following like the local county health department or the state health department, or if you're following like any governmental agencies that oversee your operations, you want to make sure that you are working and operating in those confines. And also, you want to make sure that you take the time out to develop those comprehensive plans. So you really want to sit down, strategize with your team, have planning meetings, follow-ups, making sure that everybody understands the mission that you guys want to carry out. So again, with operational planning, you also want to make sure that you hold in your organization's mission, vision, and values, and make sure those things are tied into the decisions that you make. Those are the things that's going to impact your practice, your employees, and the patients. You want to break down your operational plans into manageable steps. So if you know your goal is to change over your EMR system to a new, more efficient system, you want to make sure a lot of time goes into planning which clinic the EMR system is going to be rolled out to first, who's going to be signed up to be a super user of the new EMR system, and then the trainings that are going to take place to make sure everybody in the practice is able to use the new technology to continue to service the patient. You also want to make sure you take the time out to research best practices. Those things are paramount. There's no reason to recreate the wheel when other people have practiced tried and true methods that are very effective when it comes out to carrying out processes. So if you know EMR system is better, we're not going back in the past to get paper charts and files and looking for stuff, can't find anything, the paper is in the wrong paper file. We're not going to go back to that way of thinking. We're going to continue to move forward, use new emerging EMR systems to help people stay afloat within their organizations. You also want to take the time out to make good data-driven decisions. Analyze any data and trends to help you keep informed of those decisions. You also want to make sure that you employ those strategies. So for example, if you're keeping track of how many pre-op appointments that take place on Monday morning, you want to make sure that you have all the staff available on the nursing team and providers to help fill those appointments. You also want to make sure that you develop a comprehensive operational plan. Sometimes it takes 2 or 3 tries to make sure that plan is very refined and executable and being carried out. So if you feel like something is not working mid-plan, take a step back, take your time at looking at the plan and figure out, maybe I just need to add this piece in to make this plan more effective or more efficient. And then lastly, you want to make sure you're taking the time out to evaluate the plan. As I just said in the previous steps, sometimes like you're executing the plan and you're working with it for a long time, but something still seems a bit off. Taking the time out to look at each step to make sure that step is flowing efficiently and properly might be your saving grace when you're taking the time out to make changes within your organization. With the operational plan, the key is who is going to carry out that plan? What will they be carrying out? Where will that execution take place? How are you going to do that? And how much is it going to cost are the most important facts about carrying out an operational plan. And here it is an example. So I always like to try to tie in examples so people can get visual aids on what you're talking about, especially if you don't work in healthcare operations. We are the people behind the scenes that make everything flow and go. So when you come in the office, the staff is there, the nurses are there, and then the patients come in. So this is Operation Plan by Example Healthcare Center. The first thing we want to do is our general goal is to reduce spending. This strategy is going to be a cost-saving strategy. With the action to do this, we want to make sure we optimize scheduling, have staffing and patient flow. The second part of this plan is going to be able to support staff to reduce burnout and turnover, making sure that we have training and development in place. The also biggest key thing is also celebrating your employees, making sure that they feel appreciated. Some of those things, even though they might be small, those make a big impact on employee retention. And a person that's going to be taking care of this responsibility in this example is Manny Day, and his deadline is going to be April 2023. The next goal is to increase the number of prior authorizations. So one of those things, strategy is to improve productivity. You want to create a master list of all the procedures that require prior authorization. And the ones that you use most frequently, you also want to keep track of the authorizations that you get declined. Sometimes they may get declined because of the fact that the provider may have forgot to list the reason why the patient needs that particular appointment. So just going back, having a conversation with the provider, asking them, can you reevaluate this and add this so we can resubmit it, might change the game for you. Communicating with your front office team about procedures that require prior authorization. So you know your front office and your prior authorization team will work together to make sure that they are available to schedule patients, and they know, hold on, this procedure needs a prior authorization. I'm going to send this message to the prior auth team, have them get the authorization, and then they'll schedule the appointment. And this is going to be completed by Stephanie Rivera, and she's going to do that deadline by March 2023. Another goal would be how to improve office wait times. That's one of the joys of working with operations. We know that patients come in, they are, could be having long wardens upset because they couldn't find parking, and they come in with an attitude and be rude and nasty. We get it, life happens. So one of the things that you want to do is make sure you give them the ability to have a good experience from the point that they walk in. So this operation strategy is going to be enhanced quality. We want to make sure that we are going to be proactive with planning by doing patient outreach, collecting patient information ahead of time so that they don't have to wait that long. Another opportunity is to provide a self-check-in kiosk or tablet for registration, and then patients can also use the patient portal to help register them for their appointments. So that way they come in, they don't have to be flustered at the desk, waiting in a line and getting agitated, and then they don't have a good visit. And then we know that it's a correlation between like the patient satisfaction and their visit outcome. So we want to make sure that we're taking the time out to make sure that they have a good patient experience from the time that they walk through our doors through the end of their appointment. And that's going to be completed by me, and this objective deadline is going to be completed by June 2023.
So with that example, we move to one very hot topic, finance. So we all know that there's a lot to say about how we get funded and how we manage the budget, so we're just going to keep it short. In this case, we're just going to focus on conducting an analysis of the current operations when it comes to your budget. This will help you guys identify the areas where you can improve your processes, reduce your cost, and increase the efficiency and develop an effective budgeting system. It's good to invest in technology. Implementing healthcare technology, our solutions can help streamline operations, and it also can help you reduce costs. Utilizing data-driven decisions. If you use data to inform decisions and evaluate the effectiveness of those. And then implement the workforce management strategies. Create strategies to ensure that you are getting the most out of your employees without causing burnout. Then we move to healthcare operations product service design. It is important that you identify the needs of healthcare staff and patients, and then these all are going to be tied together. Research existing products and services, create a product service that is going to be user-friendly, and incorporate features such as automation, data integration, and analysis to make operations more efficient. And then you got to make sure that your product service is secure and is compliant with the healthcare regulations. So this brings us to our example.
So how familiar with you are using the patient portal? How many of you guys use this technology at your job every day? How many of you take the time out to educate your patients on how to use your patient portal? Okay, that number went down. Okay, so I pulled up this example because we want to make sure that we are able to help leverage technology when it comes to working with patients. We work for a multicultural healthcare center, and I know many of you guys work for multicultural healthcare centers or have multicultural patients or patients who are non-English speaking. So some of these patient portals can be customized to meet the patient's needs, but also you can use your internet browser to help kind of like change over the language of your patient portal. Sometimes we limit ourselves on our capabilities is because we don't take that extra step and say, hey, maybe if I need this to be in Karen or Burmese, I can use a Google Chrome extension to change the language so my patient can use this patient portal. A lot of the times, the patient portal, about 64% of patients prefer being communicated through this device. Another thing that patients are able to do is they're able to check on their health conditions, see what appointments that were scheduled. They have the billing option in there. Patients can take the time out to make their co-pays ahead of time before their visits. You also have your prescription down there. And then lastly, you can have upcoming or preventative planning appointments scheduled listed at the end of your patient portal. If we don't optimize the technology that we have, we will be doing patients a disservice. Patients will be often left waiting, and that they have their whole, not their whole, but a portion of their medical record available through the system. If we empower patients to use this more often, we can make sure that patients be more compliant with their treatment plans, or they can send their provider a message through the patient portal versus calling and waiting on the phone. You just have to leverage your technology. And using the patient portal can help decrease phone calls by almost 20% if you optimize your patient portal. So those are one of the things that you might want to consider when you go back. What kind of program can we put in place to help educate our patients just with this device? It's a game changer. Like as we were doing the research for this particular presentation, we were finding out a lot about what patient preferences when it came to using this, and a lot of people don't educate their patients on how to use it. We generate the user password and we give it to the patient when they come to the window, but the key part is next time you do that, maybe you should say, hey, do you think you might need assistance with going through the patient portal? Well, here's a video, or I can show you or explain to you how to navigate your way through the system. So those are some of the things you might want to consider when you go back to your clinics. So another portion of healthcare operations is quality control. Healthcare quality is a big thing in the healthcare industry. You want to make sure that you're treating patients right, the services that you provide are good, and you want to make sure that you're doing them in an efficient manner so that way it won't impact patient care. Quality control operations involved a variety of practices such as tracking clinical outcomes, analyzing patient feedback, conducting regular audits, doing assessments, and evaluating the effectiveness of new treatments. And quality control operations are essential to make sure that you are staying compliant and also you're meeting the needs of your patients within your organization. So one of the things I want to focus on for our example is analyzing patient feedback. How many people send out patient surveys as a part of a routine practice in their clinic? All right. How often are you using that data to make changes within your clinical practice after you've sent out the information? All right, hands again that dwindled down for the second time. So let's bring that point up. So if we're not taking advantage of what the patient is telling us through their feedback, we're missing a good opportunity to empower, connect, and help our patients. One of the things I like to do is the patient survey. When we do patient surveys, we get their direct feedback. That could be through text messages. A lot of provider offices offer that, through an email, one that they can return. Another way is through the phone and do a phone survey. That's a good way to keep track. So right here, our simple patient satisfaction survey. Some of the things that we can consider is How was your overall experience with our services? A lot of times we think we might be doing something really good, but the patient was like, I really didn't like how the doctor did me like that. Well, how would we ever know if we didn't get that feedback from the patient? Another one is, how would you rate the cleanliness of our facilities? Even though we know we get the facilities clean on a daily basis, but somebody kept chewing a piece of gum and it got stuck in the carpet and you couldn't get it out. Maybe a patient didn't like that, so they might, I saw that piece of gum on the floor. Every time I come here, that black spot is still there on the floor. So you never know, like, what the patient is thinking. Was the quality of care I received today satisfactory? That is a key indicator, something that we strive and hope that we are providing a satisfactory service to the patient. Was our staff friendly and courteous? That's a big one. Making sure that if you have team members that do front-facing customer service, like the front office or your call center, making sure that they are sitting up there with smiles, being very attentive, don't look like they're disengaged. You have to be mindful of that. I always tell my staff about the Chick-fil-A philosophy, that it's our pleasure to serve you. So we stopped at the Chick-fil-A on our way down here at exit 217, so we came from New York. I noticed that their cashiers, they came out to the table and bring you your food. I didn't know that they did that, because the Chick-fil-A in Buffalo where we are, you just get your food right from the cashier right when you pay for it. So I'm like, it's a stark difference in service. But that extra mile that they did bringing the food to us like an actual restaurant, that felt pretty good. And I was just like, why they don't do that in Buffalo? But then we also noticed that they still had long lines like they do in Buffalo, but their efficiency with Chick-fil-A's motto about how they have the employees outside taking the orders and they have multiple people inside their kitchen working to deliver the food, that's a part of the service quality. So I'm saying that to make sure you remember that philosophy of it's my pleasure to serve you. Because without our patients coming in for us to serve, we wouldn't get revenue generated back to us from their visits. So you have to make sure it is our pleasure to, serve you, and we're grateful for your service by you coming into our clinic. So that's one of the things that you might want to think about.
And it's not only saying it, it's also demonstrating it.
Correct. The next part is, was our appointment scheduling system convenient? So back to the patient portal, we did talk about making sure that we're able to give patients that option to schedule, change their appointment versus them calling, waiting on the phone, and then you getting back to them about open and available appointment time. You want to make sure, was the wait time for your appointment reasonable? That was a key indicator of patient satisfaction, to make sure that your patients don't have to wait that long. So that means from the point they come into the front office to the point that they leave, we want to make sure that everybody on the team is being mindful of the time. So there are a couple of providers and practices that take that extra couple of minutes and then it turn into 15 minutes and kind of throw the schedule off. So you just want to make sure you be mindful about, hey, you got a couple more patients in, making sure that you spending enough time but get everything out to accommodate the patient. So just being mindful about everybody keeping the eye out on the time so they don't throw the whole schedule off about 45 minutes and then patients get upset because they had to wait because that appointment took 45 minutes versus the actual 15 minutes that was supposed to be there. Another thing we want to do is, was the information provided to you about our services clear and understandable? That is also a good key indicator of how well you're doing. Making sure that your patients understand the information that you just conveyed to them. Sometimes that service might take a long time, like if you have to interpret the service or call the language line. Sometimes that could, cause service delay. But making sure everybody on the same page, everything was explained thoroughly, and making sure that the patient is able to reiterate exactly what you just told them. Another question is, how likely are you to recommend our service to a friend or a family member? That's a standard, survey question. And then the last one is, anything else you would like to tell us about your experience? That one is a good question, because sometimes we don't ask that and we don't know, well, if I schedule this type of appointment versus that type of appointment. That will really help me understand what's going on with me. Or they can tell you, well, you know, I've been waiting for 15 minutes and I saw that you called a couple of people ahead of me and I felt like you were just leaving me behind. So just making sure that like the patient's experience is something that's being presented while you're doing your operational planning meetings to improve on your service quality. Think about the patients and put them first. Another thing that you can do in healthcare is forecasting. Operational forecasting in healthcare is important tool to use because it can help you better manage your resources, plan for future needs. It also involves analyzing data from a variety of sources, such as your patient visit, your staff utilization, your supply chain data, and developing an accurate picture of your future demand. So if you are a type of practice that loves digging into the data and having numbers, this would be a good tool for you. So for example, back to our pre-op planning schedule, if you know on Monday mornings between 9 and 11:30 you have 15 patients that need pre-op clearance, maybe you might want to set another day during the week to have that particular schedule available for patients. And that way you have nursing staff and providers available to deliver that particular service. Or if you work in a clinic with pediatrics and children, and up in New York, we go back to school in September, late August. So we know that the back to school vaccines are very heavy during that time period. So we try to figure out how many vaccines we need, how many nurses we need available. Do we need to have a Saturday vaccine clinic to accommodate our patient? Do we need to extend hours for a week to making sure that we get all the kids vaccinated for back to school? So using forecasting tools can give you all of that information, and that way you can better plan your resources or how much staff you need or how many schedules you need to open to accommodate students going back to school who need vaccinations. This data can be used to model potential scenarios and outcomes, allowing healthcare organizations to plan and make informed decisions. So just like we talked about that back-to-school vaccine schedule, that's an informed decision that you can make just by using the forecasting tool. And leveraging these forecasts, healthcare organizations can better manage their resources and optimize patient care. So this is our example of examples of forecasting. So you have the benefits of predictive analytics. The first thing we traditionally use forecasting for is improved patient care or patient outcomes. You can also tailor this to personalized treatment plans. You could apply it to population health management. You could identify at-risk patients. You can also use it traditionally for chronic disease management, forecasting equipment maintenance needs before they arise. So if you know you have that one copy machine in your office that always want to act up when you're trying to print something out, or give patients a copy of something they need faxed and it's always on a fritz, forecasting can help. Maybe I need the maintenance guy to come out 2 weeks earlier than what they usually come out. So those are some of the things that you might consider. Healthcare tracking and digitalization, preventative human errors. You can also use it towards fraud detections and insurance billing claims. And then you can also use it as reducing your overall cost in healthcare.
So another thing is we're going to talk about strategies. It is very important to develop strategies in the healthcare in terms of operation and efficiency. It's important that you understand your current environment to make these strategies happen and define the organization's goals and objectives when creating these strategies. You should develop a strategic plan, so a very focused plan on what you want to do, how you're going to do it, and we come back to all those questions as how, when, how much, and all. You need to assess the results to make sure that the strategies that you put in place are actually working, and continuously monitor them and adjust the strategies as you go, again, to ensure that they're working, and if there's any need of changes, then do it at the moment. Now, I would like anyone to read This quote from Benjamin Franklin.
Audience member, please.
Anyone?
If you fail to plan, you are planning to fail.
Yes.
So you have to remember that if you do not plan these steps out and you think, okay, tomorrow I'm just gonna up and just change the way we do our front office registration without planning, without telling the staff, we just gonna go ahead and do it tomorrow. That's gonna be a plan that fails. So you wanna make sure that you take the time out, you sit with the stakeholders involved and actually come up with a comprehensive plan that's gonna make sure that if I'm gonna change the registration process on Monday morning at 8 o'clock, the team has been well prepared for at least 4 weeks in advance. We went over the protocol, we practiced it, now we're able to execute. You will be able to set your team up for success. So this is an example of a hospital strategy map. And these are some of the things you want to think about when you talk about healthcare quality, health education, public health services that enable our communities to be better and healthier. So you want to make sure that you meet customers' needs and expectations. We talked about that. Provide responsive and accessible services. So if you need to change your appointment times, offer more telehealth visits, that will be something that helps the patient. Provide respectful and culturally sensitive treatments and services. So if you have any Muslim women that go to your clinic and they don't want a male provider, you want to make sure that you have female staff available for those patients. And then you also want to make sure you continually support successful, healthful outcomes. Then you have the financial management piece where every organization's goal may be to make sure they keep their doors open and be able to operate effectively and efficiently. You can increase revenue, also budget and manage the resources appropriately. You also want to make sure you have an internal perspective. Establish a good reputation of excellence, and that's what a lot of clinics try to make sure they provide when they have patients coming in through their doors. You want to promote yourself as a leading healthcare service provider. You want to encourage and equip patients and people to do better at managing their health. You also want to make sure that you improve partnerships and collaboration with people in your community, provide customer-focused healthcare services, improve healthcare outcomes. So if you know that literacy is an issue that some of your patients have, they might not understand their health literacy, providing a reading program through one of your program support programs will help you mitigate those problems and it help improve patient outcome. Improve and expand access to care. We talked about expanding hours, setting specific appointment schedule types, making sure that healthcare system is easy to navigate. We talked about that as well, making sure that you give patients the tools and resources to do that. You also want to manage your business, improve resource management, improve the administrative process, produce and analyze and act upon performance data. We talked about forecasting and data-driven decision-making. And also lastly, culture and capacity. You want to make sure you hire the right people. Sometimes people need to be changed around because they might not be a good fit for a certain position, but they might be an effective person in a different position. You want to develop a competent workforce, and then you also want to be ethical and transparent and accountable. Healthcare operations supply chain management. We really don't talk about this, but this is a process within healthcare operations. We all know that during COVID-19, the supply chain was drastically interrupted by everything, so it was hard to get supplies. But that is hopefully almost over, and we're able to make sure that we are able to get the resources that we need. But a good thing to know is you want to make sure that you have an expert person managing your supply chain, somebody who's able to understand the whole process of procuring the stuff that you need to actually delivering it to your clinic. Another part is understanding the different stages involved in the supply chain is essential for efficient and effective information. So that means if you're working with a supplier who provides your gloves, who provides your hand sanitizers, masks, or even your exam room beds, making sure that they don't try to get it from a far location that can disrupt your services. Also, having effective management with the supply chain can help ensure that the products that are delivered are cost minimized and meet the standards that the quality you need to help your patients. So if you want to make sure that you have an accurate scale or accurate blood pressure cups, you don't want to go to the dollar store and buy a blood pressure cup for $1. You make sure you want to spend some money on good equipment. And also utilizing technology, making sure that you are able to find good supplies that come to your clinic. So this is an example of our supply chain. So you have the healthcare systems and then the non-healthcare systems. You have Benson and Dickinson and Johnson & Johnson will be your manufacturers. Your distributors could be Cardinal Health or Owens & Myers. Your wholesalers are going to be Amerisource, Bergen, or McKesson. And then we'll have our retailers would be CVS, Caremark, Rite Aid, Walgreens. Then you have going up to the General Hospital. Then you have it going to the clinic like Jericho Road or the Mayo Foundation, Intermountain Healthcare, Mercy in the Cleveland Clinic. And then lastly, the other supplies will be going down to medical firms like Abbott and Pfizer. So that's how you get stuff from your clinic or to your clinic.
So like we have mentioned several times during this presentation, implementing technology-based solutions, it is essential in cost reducing and giving a better patient service. Using electronic healthcare records to store and share patient information, it keeps them more private and reduce the amount of paperwork. Telehealth services to provide remote access to care that includes offering the patients video or phone visits with their providers. Automated appointment scheduling system to save time and reduce need for manual scheduling. That leaves your staff with more time to do or focus on other jobs that are in need at the moment. Streamlining processes and procedures, such as reducing the paperwork and automating administrative tasks, can help to improve the efficiency and reduce costs as well. Data analytics and AI-driven solutions can help healthcare providers gain insights into patient care and identify the areas that they need to improve.
So the last part is the healthcare service delivery. Healthcare service delivery is important to providing quality care to individuals and communities. We ensure that people are receiving good care in the right place at the right time, and they have access to primary care, specialty care, preventative services, long-term care, mental health, substance abuse, supportive services to help them manage their health, and then with the best possible outcomes for individuals and their community. So you want to make sure that you provide good quality care, coordinate the multiple disciplines, provide the access, and making sure that the healthcare services are provided are safe and efficient. And this is our example of our delivery service. You have the Integrated Health Service Delivery Network, the healthcare capacity building, the curative or preventative healthcare approach, the patient-centric approach, health technologies adoption and optimization. And this is what it looks like in practice.
Okay, so with this, we finish our presentation. We apologize that it took longer than we were expecting. If you want to learn a little more about us, Jericho Road, their programs, their services, their global work, feel free to scan the QR code. It's going to take you directly to like a tree menu that you can choose from. It also has the links to our Facebook and Instagram pages. So feel free to follow us online. And
thank you for attending our presentation.
Thank you so much.
Any questions? I'm sorry.
We have 5 minutes.
For questions.
Yes.
So anybody have questions?
Sorry?
Oh,
Yes.
yeah. So I do a lot of auditing with reports to making sure like how many times front office staff make mistakes when they register in a patient. So that'll give me a clue that maybe that front office team member might need some additional training, or I monitor or look at how many calls we receive through our call center to see what is our drop call rate, how long is our call handle time, those things we take a look at. Another thing I like to look at is making sure that people are following process and procedures correctly. So I take a look at those things. So I get reports. I put my eyes and ears on the ground. So I make sure I take time out every week on Tuesdays are my site visit days that I go to all 5 of our clinic practices and I just see what's going on. I connect with the team members. I connect with the providers so I can gauge to see how the practice is doing. So there's many different ways you take a look at it, and I keep track of it. And then if I see trends that are alarming, I bring those up with upper management to see what we need to do to change the direction in which we are going. Okay. Any other questions? Yes.
Thank you for just sharing all those practical ways. I think that was really helpful. But I'm just like thinking like how do you navigate with like just like newly arrived refugees or like patients who like don't speak English at all, like just all those things of like the technological stuff you're recommending, like patient portal, if they're like they don't know how to use an app or like a phone, or even just like automated services or like paperwork if like they don't speak English, like how do you like navigate with that?
So that's a question that we've struggled with a long time. So at our clinic, 2021, we had like a lot of Afghan refugees that came over to the United States, and we used to hold weekend registration clinics to get them acclimated to the U.S. healthcare systems. A lot of those patients were on cell phones. They brought tablets to the clinic, so that kind of like gauged me, maybe they understand in technology more than what we perceive their understanding technology. So it's working with your language service team to kind of gauge them to see how comfortable they are with doing those things. And then you also see a lot of them out in the community doing self-checkout at the Walmart and the Target. And I'm like, okay, well, if they can use that and they on Facebook getting that EMR system down to use the patient portal is not going to be hard. The key is to make sure that we put it in the language that they understand, and then also educate the patient on how to navigate. And I think that that's the key component piece, is that we really don't take the time out and say, this is how you log on to the EMR system or the patient portal. This is where you go to check for your labs. This is where you go to look at your medication. This section right here, you can communicate with your provider. So I think it takes a multi-step approach of providing that patient education, and then helping them empower, and then also providing them continual support. So every time they come into the clinic, if they have additional questions, making sure that you take the time out to address those things.
And just to add a little bit more on that, that also comes to your partnerships. Like, we partner with several entities around Buffalo, so when the refugees come, we are making sure that there are someone that is helping us communicate with them and in between before bringing them to the clinic. And then once they're in the clinic, then we can provide them with the services of interpretation to help them work through their appointment and anything else that they need to do afterwards.
Any other questions? All right. Thank you for coming. If you need a picture of our QR code, that'll take you to our link tree and all our social media accounts. And then the last page, if you need email addresses or anything to contact Stephanie or I, the information is available. Thank you all for coming.
Thank you.